Okay, are we ready? Whenever you're ready. Thank you for being here. Good afternoon, and this is the public briefing for the coronavirus, 2 p.m. March 23rd. I'm Brian Beam, Calcasieu Parish Administrator. We're going to begin today with our briefing with OEP Director Dick Grimion.
Thank you, Brian. Not much to report operationally today. I think everyone is still kind of taking in what the governor's orders were yesterday. As I stated yesterday, the governor was going to have some clarification of some of those issues by 5 o'clock today when this order goes into effect. We've been getting a lot of phone calls asking if various things were open or closed or whatever, and all we can go by is what the guidance that the governor's office issued us. And if you go to the governor's website, it's right there, and you can read it for yourself and judge whether the questions you're asking are covered by the governor's order. In general, but the basic message is stay home, and I think the mayor had a good saying yesterday. I don't remember what it was, but maybe he'll repeat that today about staying home.
$1 every time you say it.
Franchise fee, right? The medical subcommittee is continuing to do medical planning. The main focus right now is how can we increase the number of tests being done. Obviously, still the demand is greater than the supply, and they're working through some of those issues. Dr. Kavanaugh may have a comment on that as well. So with that, I will yield the floor. I'll yield the floor to Dr. Kavanaugh.
Hi, good afternoon. I'd first like to go ahead and report the latest number of cases that we have both within Louisiana and here within Southwest Louisiana. As of noon today, we had 41 parishes across Louisiana that had positive cases of COVID-19. We had 1,172 cases across the state of Louisiana, and we had 34 reported deaths. Here locally in Southwest Louisiana, we have 4 official cases in Calcasieu, 2 in Allen Parish, and 1 in Beauregard Parish. But I would like to point out that we know that there probably are more cases out there. Remember that there is a delay from the time that a person gets tested to the time that those test results then come in. Then there's another little bit of a delay once the physician receives the test results, because it takes 24 hours before they necessarily report it to the lab. And then our website is only being updated once a day. And so it could be sometimes a day or 2 days once we know that there's a positive case before it actually shows up on this map. And that is what has actually happened today. I can confirm that in Calcasieu Parish, we have our first reported death. And that has been reported since our update at noon and will be reflected by tomorrow whenever the numbers on the website are updated again. And we're not going to release any other specific information about that death at this time, but more information may be forthcoming after we have had time to process and investigate that case. So a few other things that I'd like to mention today is that this was not all that unexpected. We know that this virus is serious, and that is why we have done all of the measures within the community that have been done to try to protect people. And the actual number of cases, whether we have 4 cases or 6 cases or 10 cases or even 100 cases within the region, doesn't change what we need to do right now, which is we need to be staying home and protecting other people. Even if you're young and healthy, although this virus certainly affects people with comorbidities, which are underlying chronic health conditions, it affects them more. They have more serious outcomes in most cases when you look at averages, but that doesn't mean that if you're young and healthy, you are immune from this virus. This virus can cause severe symptoms and can cause hospitalization and death even in young, healthy people. It's not as common as when you have a whole bunch of chronic health conditions, but it definitely can happen. And so I just want to make sure that everyone understands the seriousness of the situation. I think that that most of you are very aware and have been extremely cooperative with all of the measures that have been put into place. But just sort of a time for us to remember that this is real and that real lives are at stake when we don't stay home. So just wanted to remind everyone of that. We've also been getting a lot of questions about who all needs to isolate and for how long. So if you are someone who has come into contact with a person who tested positive and you were defined as a close contact, which means that you've been within 6 feet of that person for 30 minutes, then you are defined as a close contact. And if you are a close contact of a confirmed positive case, you should self-isolate, meaning not to see anybody else for 14 days, okay? If you have had symptoms, but testing wasn't available and you were told to go home and just kind of ride out the symptoms and come back to a hospital or healthcare facility should you need medical care. In those cases, you need to be symptom-free for 3 days. That means no fever, no ibuprofen or Tylenol to cover up your fever, and not coughing anymore for at least 3 days, and it has to be 7 days since you first started having symptoms before you would be considered not infectious anymore and could sort of be in contact with other people. So this is a time when mental health and taking care of ourselves is also extremely important. So want to remind everybody that even though it is stressful, trying to do things that tend to reduce your stress are extremely important. Stress not only affects your mental health, but it actually affects your physical health too. When you're extremely stressed for a long period of time, that actually reduces your immune system's ability to fight infections like this. And so we have to remember that even though these are challenging times, that we still have to make sure we're taking care of ourselves. And that is all I have for today. Thanks.
Are you taking questions?
Oh, yes, I can take questions.
Let's see, one thing I wanted to ask, the person who died, has everyone who may have come in contact with that person while they were infectious been notified?
So more than likely that will happen very soon, but once again, the website is updated at noon. We found out about the case since then, so that is going to be an active process from this point forward.
And also, I think this question should be directed to you. You know, there are seamstresses in the area who are feverishly sewing masks, hoping that perhaps they might be of some value to medical people in the community, if not regular citizens. What, if anything, can you say about what would need to be done for those masks to be useful to medical people? And is there any value to regular people who maybe are going grocery shopping to, you know, put a T-shirt or a scarf over their nose and mouth?
So there's no data to suggest that putting a T-shirt or a scarf is going to protect you if you're not sick from other people who are. Even wearing a surgical mask is not going to protect you from breathing in the virus if someone else is coughing next to you. So the best thing that we can do is mask people who have symptoms. Now, homemade masks are not tested and tried, And more than likely, they are not going to have a fine enough particle size filter to truly be effective against a virus like this that's very, very small, and that would be able to cross a cloth barrier. Now, that being said, the CDC has added some guidance to their website that in extreme dire cases, when there is absolutely nothing else available, that maybe some of those sorts of homemade products could be better than nothing. Although there's not really any data to prove that, and I would definitely not recommend that as an option unless there are no other options available.
Okay, thank you.
Anything else?
We'll have some at the end.
Okay, thank you.
Thank you, Dr. Kavanaugh. Today, we're going to not have every speaker unless they have an update. That's totally up to them. We want to hit the main points, but before I do any of that, I want to thank all the folks from American Sign Language Interpreter Group that have helped us throughout this. And I've been remiss in not mentioning this earlier, but to communicate with all of our residents throughout the region, we greatly appreciate that. Today, we have Ms. Sylvie Sullivan, who is with us. She actually, the last couple of days, has been with the governor's office and their press releases, and we appreciate all the work you're doing. Next, we're going to go to Mayor Nick Hunter of Lake Charles.
Thank you, Brian. Good afternoon. Certainly, the seriousness of the situation is undeniable right now. We have our first death in Calcasieu Parish, and while I know details will eventually come out, whoever that is, I can tell you, everyone in this room, and I believe everyone in this parish right now in Southwest Louisiana, our prayers are going out to that individual and that family. And so again, as Dr. Kavanaugh said, this is a serious situation. As we continue to work through the directives issued by Governor John Bel Edwards at yesterday's press briefing, I want to reiterate that we fully support Governor Edwards' stay-at-home order. Again, we will continue to repeat that message in coming days and weeks. Stay calm, stay safe, and stay home. We're still working with our department heads to finalize plans on operations of city services. We had a meeting this morning, a very productive meeting. But I want to reassure everyone that we will be still operating essential city services, but on a much more curtailed basis. We are trying to abide by the spirit of the governor's order as much as possible, but people still need to know that water, sewer service is still available. Garbage and trash will still be collected, and our public safety crews will continue to operate with, again, a curtailed team. Currently, our transit system will continue to operate. We are taking extra precautions, including working with a local vendor to sanitize the buses throughout the day. And we will advise you of any modifications and services if they occur. We are also taking steps to limit the amount of riders per bus, and I'm going to go ahead and apologize right now if that causes some extra delays, but we believe in what the governor has asked of us, and we do not want to overload our buses right now. That would be very counterproductive. Before we close business today, we'll be issuing a complete release on how this stay-at-home order will affect city services, so please stay tuned to local media outlets as well as cityoflakecharles.com and the Lake Charles City Hall Facebook page. In the coming days, we'll be sharing valuable information on a daily basis to help you get through the coming weeks as this situation unfolds. I also want to make sure people understand that all city buildings and facilities will be closed to the public. This includes City Hall, Central School, and 1911 Historic City Hall. I've also been asked by Chamber Southwest Louisiana to encourage business owners and people affected by this situation to log on to swla.org, click on the COVID-19 button, and then click on Take the Survey. We have said this from the beginning. The immediate concern is always for the health, the safety, and the welfare of our citizens. But in the coming days and weeks, it will become even more apparent the economic impacts of this situation on local businesses. And so we'll be working with the Chamber to make sure that we provide all the resources that are available to our local business community. And in doing that, also helping the thousands of employees of these businesses here in Southwest Louisiana. If you have a question or concern, please call the Mayor's Action Line at 491-1346, or, and I must stress this, if you are able to email, because we are working with limited services, limited staff, please email us at Mayor's Action Line at cityoflc.us. We continue to receive and respond to concerns and inquiries through this system. Thank you.
Thank you, Mayor. I believe for the parish and the other 5 cities, you're going to hear a very similar outcome, and that is the big difference. We're still providing key services, essential services, but because of the health order, all of our buildings are really closed to the public in that sense, but that doesn't mean we're not providing those key services. So we appreciate everybody's patience during this time. At this time, we don't have any further speakers, but we certainly would take any questions that may be out there. And I have spoken to Sheriff Mancuso. He still wants to send the same message as he did yesterday. I'm sorry, Senator Ronnie Johns, I forgot. He does have an announcement regarding something coming up tonight. Thank you, Ronnie.
Thank you, Brian. Since our meeting yesterday, 2 things have transpired from the state level that I think are of great importance to our state. First of all, this afternoon, the Louisiana Department of Revenue announced that they are going to mirror what the federal government has done in terms of extending tax returns. Instead of April the 15th, your federal returns will be extended until July the 15th. On the state level, instead of May the 15th, which is the normal date for tax returns, they also are going to be extended until July the 15th, and that is with no penalty. That was announced this afternoon. The second item is that tonight, Governor John Bel Edwards will address the state of Louisiana in a 1-hour televised event beginning at 7 p.m. The governor will, I think, share with every citizen in this state that is capable of watching what our state is doing in terms of trying to get out in front of this and do the right thing for the people. Our governor and his staff, along with the entire legislature, I can tell you, is working very hard. I've been in touch with our legislative leadership on a daily basis, and we are doing everything in our power to minimize this, but also protect the safety of our citizens. So would encourage everyone to tune in to Governor Edwards' a presentation tonight on what state government is doing. Thank you.
Thank you, Senator. That's very helpful. At this time, we will take any questions anybody may have. Yes.
First of all, we've been getting calls that, well, actually, I talked to Miss Pearl Cole, and she said that Abraham's tent is closed. And we're getting phone calls from people who are concerned that the homeless have nothing to eat. I was told Tarek Polite is perhaps doing something about that. Can you update us on that? And I mean, for example, are volunteers needed to, say, for example, go buy meals and put them on a picnic table somewhere, or what can you tell us about that?
Sure. I've actually been in discussions with, Denise Durrell, who is here with United Way. I'm going to ask her to come on up, and she has an update on that is addressing that issue regarding Abraham's tent closing, and more specifically how those folks are being helped.
I am happy to announce that even with the closing of Abraham's tent, that the Salvation Army is actually actively feeding. They have converted to a to-go operation, but they're actually open for 15 meals per week. Monday through Saturday, they actually feed twice a day, and on Sunday they have 3 meals. They provide breakfast, lunch, and dinner. We are working with them right now to determine if now that we know confirmed that transportation is still available, that they're probably going to be shifting their breakfast time to make it a little later so that it coincides with the bus that run in that neighborhood. So, but they are actively providing and plan to. We were concerned with the additional cost of them with the added food, and United Way, we've agreed to cover that cost for them so that they can continue to feed because we're expecting that they'll have a lot more people there. They are in need of volunteers to help, and you can go to our website and sign up if you have any opportunity that you could do that to help them process the food and get it out to the individuals that are coming out. They are practicing the safe distance, and they've got that in place, but we're happy to report that they are willing to feed anyone who shows up there. So,
And where are they feeding the people?
at the Salvation Army on Legion Street.
Okay, I don't know if this would be for you. Oh, and when you said your website, do you mean United Way?
United Way,
or 211?
swla.org.
Okay, we also received a phone call as to whether the Civic Center in Burton Coliseum or some other facility is going to be repurposed for hospital beds and overflow. I don't know exactly who that would be directed to.
Me either, but not me.
Okay.
I do know that.
Teresa, let me go back to your original question to Denise. We're having a lot of people ask, how can they help, which is very encouraging. And we believe a strong way is for people to donate to agencies like you've heard that are helping in this way, or other faith-based or others that may have things they're already doing on their own, and there are a lot. So that's how people can help. I think if they call 211, they probably have a good list of folks they know of that are helping with feeding and other things. So that's available to anybody who wants to help. So we encourage calling 211 to get more information on both what the Salvation Army is doing and others that may be out there that we're just becoming aware of. Can you restate the question you asked after that so we can kind of see if we have an answer for you?
You know, I can't remember what I asked, but, about the hospitals. Yeah, people want to know if you guys are repurposing Burton Coliseum or perhaps the Lake Charles Civic Center for use as hospital space if we get overflow here.
Okay.
There's no discussion of repurposing those areas for a hospital. There is an isolation site at Chico State Park. That is the isolation site for Region 5, which is where we are, Region 4 and Region 6. The Civic Center, I'll let the mayor answer, but I think the Civic Center is closed. There's no activity there that I know of. And today, some people may be seeing some activity around Burton Coliseum. We're actually practicing our drive-through testing plan, but no announcement's been made on whether that's actually going to be opened or not.
You said your drive-through testing program. Do you know when that will start?
I do not, Teresa. We're just going through our planning phase right now. We don't have any information on when one might be opened.
And presumably people would need a referral for that?
The details will come out if that decision is made.
We are also being asked why the grocery stores don't do pickup only so that people don't need to wander through stores but can just show up and pick up their order. I guess it's probably too difficult for them, but I just thought I'd throw that out there.
That was covered in the governor's order, and grocery stores are exempt.
Well, yeah, it's the customers who wish they could just go by and pick it up, at least some of them. And we're continuing to get phone calls from people who are working at large industrial sites who I realize that these facilities are exempt, but they're still very frightened that they are in close proximity to other workers and that they may be bringing home, this to their family.
Teresa, if anyone has a health complaint at any kind of any place of work or anything like that, I think you can report that to the Office of Public Health, and they'll look into it.
Thank you.
I see Dr. Kavanaugh frown. Is that not right?
Yeah, I don't think we would have regulatory authority over a private industry like that unless the state health officer deemed that it was a public threat. So I think that those would have to go through other channels. I can look in and see where would be the best place to send those sort of complaints, but I don't think we have the capacity to handle those internally.
Well, I know several of them have mentioned OSHA, but I don't think OSHA responds to an immediate situation. I could be wrong on that.
So I will ask that question and see if I can get you an answer.
Thank you.
My apologies, I didn't mean to put Dr. Kavanaugh on the spot there.
Any other questions at this time? Okay, at this time, we actually do not have a public briefing scheduled for tomorrow. However, obviously, that could change, but we are tracking this literally daily, hourly, and so we will communicate when the next one will be scheduled. We just don't have that at this time. I would remind everybody, as Senator John said, the governor will be on TV tonight for an hour-long address to all the citizens of Louisiana. We encourage everyone to watch that and keep up with all those websites that were mentioned as well. And if there are no other questions, that'll wrap up this briefing. Thank you.